Namaste viewers, I'm Dr. Tejal Shah from Pune, Maharashtra. Today we are going to talk about the most distressing topic of discussion, which is hair loss. We've all been through there where we see the broken strands of our hair in the shower, on the pillow or between our fingers. Hair grows naturally in the three phases of hair growth cycle: anagen, catagen and telogen. Telogen is a shedding phase. Whenever the shedding phase is being prolonged for a due course of time leading to an excessive hair loss, is a time when you need to investigate or consult somebody to understand the root cause of it. There are many phases of hair loss. Let's see what is a male pattern baldness. Male pattern baldness is also called as an androgenetic alopecia, which can start as early as 20 to 30 years of age. In men, the hormone in the name of DHT, dihydrotestosterone, is a primary hormone which is responsible for hair loss. A male pattern baldness is actually a genetic disorder seen in men as they age. When this phase starts very early, in the age group of say 20 to 30 years of old, male pattern baldness is characterized by a receding hairline from the temples and thinning of the hair from the crown. This is a typical pattern which is also called as a horseshoe pattern or a male pattern or androgenetic alopecia. Unlike its counterpart in men, women also loses hair in a pattern which is called as a female pattern baldness. There are multiple factors which are responsible for a female pattern baldness. Certain nutritional deficiencies like especially iron deficiency anemia, deficiency in protein and some macronutrients can lead to hair loss in women. It's very peculiar in women during or post-pregnancy phase. Female pattern baldness is been characterized by thinning of the hair from the crown area, whereas the hairline is still preserved. This kind of pattern of hair loss is also called as a Christmas tree pattern. Let's look at the cause of hair loss. In common, hair loss can happen to anybody who's compromised nutritionally. In women, it is commonly seen in the metabolic disorders like PCOS and hypothyroidism. Post-pregnancy in the lactating phases when women see a lot of hair loss. At the same time, it is also observed some connection with people suffering from celiac disease, type 1 diabetes mellitus. There are certain medications also which promotes hair loss, especially the chemotherapies. While hair loss can be daunting, modern trichology offers a variety of treatments to treat the hair loss at a very early stage. Microneedling is a very famous procedure when it comes to treating hair loss using a specialized drum-held handheld device of derma rollers using with certain meso solutions that acts as a hair cocktail and that promotes the new collagen as well as increasing the blood circulation to that particular area where the hair follicles have been affected and causes growth over a due course of time. When these microneedling is clubbed with PRP, where PRP is used as a meso solution, helps in promoting lot of growth factors, which includes your connective tissue growth factors, your endothelial growth factors, your TGF1, TGF2. These are the growth factors which essentially helps in regrowth of the rudimentary follicles which have been not growing for a while now. There have been certain hair regrowth lasers available with the cosmetic physicians. Considering few settings with hair regrowth lasers along with PRP and mesotherapy promises a very good results. To ensure that these newly grown hair persist for a longer time and they lie into the phase of catagen for a longer time, you have to focus on a high protein diet as well as you have to nutritionally supplement yourself well. Positive results in hair loss are possible, but to ensure that diagnosis should be spot on. Few devices or advanced trichoscopes which a doctor uses to scan the scalp ensures us to let us know that the hair belongs to a particular phase of growth cycle. For example, when doing a trichoscope examination, if you see that the hair is lying in the telogen phase, be any kind of treatment offered to that scalp, the hair is definitely going to fall off because it is already in the shedding phase. So, understanding the hair regrowth stage before treating it is very essential to ensure that you see good results. Trichoscope also helps in picking up certain scalp conditions like the inflammatory autoimmune diseases of alopecia areata, which can be picked up at early stage, and certain steroid treatments can be started at the early stage to prevent the further growth of the alopecia areata patch. It is essential to consult an expert to tailor an approach to exactly what treatment you would need in due course of time. I appreciate your time with me today. For any personalized concerns or to simply share your story, I am here to listen and assist. Thank you.